question for today to the Honourable Alexander O'Connor to ask question 84/2020. You have the floor, sir.
Thank you, Honourable Speaker. Honourable Speaker, sir, I rise to ask question number 84/2020 in today's order paper under my name, and it's directed to the Attorney General and Minister for Economy, Civil Service and Communications. Can the Minister please update Parliament on the COVID-19 tracing app? Thank you.
I now call on the Attorney General and Minister for Economy, Civil Service and Communications, the Honourable Ayaz Syed Qayyum. You have the floor, sir.
Thank you, Mr. Speaker. Sir, I'd like to thank the member for this question. Mr. Speaker, sir, we've talked about this tracing app a couple of times. This week, I'd like to give some details. Mr. Speaker, sir, the app, as announced by the Honourable Prime Minister on the 15th of May, will be called the Care Fiji app. It's harnessing the use of non-location tracking technology using Bluetooth Low Energy or LE with privacy and security central to the app design. And of course, it's combined with other national public health measures to prevent a resurgence of COVID-19. The Care Fiji mobile app, Mr. Speaker, sir, is based on the open source reference implementation of the Trace Together mobile phone app or Blue Trace protocol developed by the Singaporean government and mirrors the COVID-safe mobile app widely adopted by millions of Australians in the campaign to eliminate COVID-19. We hope to, Mr. Speaker, sir, we currently, after the testing through Google Play Store and Apple Play Store, or App Store, I should say, we're testing that. We hope to finalize that by the end of this week and hope to have the Honourable Prime Minister officially launch it next week sometime. Mr. Speaker, sir, just before we get into that, I wanted to just very quickly highlight the rationale behind the app tracing. There's a very good article by the University of Oxford Big Data Institute and Nuffield Department of Medicine that is titled Digital Contact Tracing Can Slow or Even Stop Coronavirus Transmission. And I'd like to quote from it specifically. It says, and I quote, "Delaying contact tracing by even a day from the onset of symptoms could make the difference between epidemic control and coronavirus resurgence. We've stimulated coronavirus in a model city of 1 million inhabitants with a wide range of realistic epidemiological configurations to explore options for controlling transmissions. Our results suggest a digital contact tracing app, if carefully implemented alongside other measures, has the potential to substantially reduce the number of new coronavirus cases, hospitalizations and ICU admissions. Our models show we can stop the epidemic if approximately 60% of the population use the app, and even with lower numbers of app users, we still estimate a reduction in the number of coronavirus cases and deaths." It goes on to say, and I quote again, "We need strategies to exit from the lockdown whilst minimizing the risk of resurgence. Combined with other interventions such as community testing, digital contact tracing can help prevent coronavirus from rapidly re-emerging." Unquote. Mr. Speaker, sir, as you know that we've talked about a travel bubble, as you know we've talked about the need to be able to balance the need to ensure that there's health safety measures put in place, that the Ministry of Health and the contact tracing team are ability to get access to information and data really quickly, and on the other hand, of course, to get economic activity rechugging again. Mr. Speaker, sir, the app very simply works through Bluetooth technology. So essentially, if all of us download the app now, our Bluetooth signals will just bounce off each other. The Ministry of Health won't have access to that information, but assuming when you walk out of this room, 2 days later, if I'm confirmed a positive case of COVID-19, then the Ministry of Health will tell me I've done a swab test. They'll say, okay, we need to now access all the people you've been around for more than 15 minutes or more, and they've been close to you within a distance of 2 meters. What the app does, Mr. Speaker, sir, is store that information for the past 28 days. And every day, of course, a day falls off because you're going to the 29th day, so the last day drops off. From that you then have to, once you know you've got COVID-19, you still then have to give your permission to the Ministry of Health, who then are the people at the back end. They'll give you an encrypted code, and you put in that code, and then gives the numbers to them. They will then dial those numbers and say, you have been next to so-and-so that has been tested positive, please come in for a test, or please go into isolation. Because the current practice is, people have to remember who they have been in touch with or been around, and sometimes people forget. This very quickly mobilizes it. I know there has been some talk, and in fact some members of the opposition said, oh, don't do this because, you know, they'll get all the information, which is a whole lot of nonsense, actually. And I've got now, Mr. Speaker, sir, what permission? So if you, those of you, if you've got an Android phone, just let me tell you, if you have an Android phone, and in fact in Fiji, 92.5% of people who use phones have an Android phone. 7.4% of the people who use phones in Fiji have an Apple phone. And then the others have different systems, 0.08%. In Australia, it's very different. Australia, 45.79% of the people have an Android phone, 53% have an Apple phone. Singapore, 65% have Android phone, and 33% have an Apple phone. So, if those of you who, I know most of you are on Viber, for you to be on Viber, if you have an Android phone, they already have access to your location, they have access to your contact, they have access to your calendar, they have access to your camera, they have access to your microphone, they have access to your storage, they have access to your actual telephone. Those of you using Viber, all of us are, I think. If you're using Messenger, they have access to all of that, including SMS. If you're using WhatsApp, they have access to everything. If you're using TikTok, they have access to your contact, access to your camera, access to your microphone, access to your storage facility in your phone. Instagram, location, contact, camera, microphone, storage. Care Fiji app, Android. First, you have to, for you to get on, simply turn on your location, the Bluetooth goes on, you get off your location. So nobody will know who you've been with until you get prompted. No one will know where you actually were in close proximity with them. They won't know whether it was under the tree in Melbourne Park or in some hotel room or in some office place or wherever, in the nightclub, whatever it is. They won't know that. Or golf club. Nobody will know that. So that's the beauty about this technology, and Mr. Speaker, sir, and therefore it's critically important. What is also interesting, Mr. Speaker, sir, is that we've got a list of all the countries over here, Mr. Speaker, sir, that have got some form of an app. What is really interesting, of the 48 contact tracing apps being used in 31 countries, from the 48, only 8 apps use Bluetooth only, 16.6%. 26 apps, Mr. Speaker, sir, or 17 countries, use GPS, that actually track you through your GPS. 13 apps in 10 countries use GPS and Bluetooth. One app in one country uses surveillance data, one app in one country uses user-submitted geodata. So they're quite actually penetrative in the sense in terms of the information required. Now, we have gone to great lengths, Mr. Speaker, sir, to ensure that the privacy is maintained at all times. And so, Mr. Speaker, sir, what we have similarly done, and once the app is launched, all you have to do is download the app. Once the testing is done, they'll ask you for your initial location, then you switch it off, then the app is on. For those of you who use iPhone, I know the Honourable Prime Minister uses iPhone, for the app to be on, it always has to be in the foreground. But those of you who use Android, it doesn't have to be in the foreground, it can be in the back. So, Mr. Speaker, so I don't want to take up too much time, but essentially to say that this is a very good product. We were, in fact, when we had the discussion with the New Zealand High Commissioner today at lunchtime, they're very excited about this because one of the requirements, as you would find in most countries, once you go to those countries, they'll also require you to download their app, because then they can also ensure, should you come in close contact or you have COVID-19, they can very quickly do the tracing, hospitalize you, etc. So we would perhaps also be inclined that way that any tourist coming to Fiji would actually need to download the app. So everybody's on the same page. It secures them, it secures us also. And Mr. Speaker, sir, we'll be rolling this out. We also have been working with our Fiji Care, which has been providing insurance to all the civil servants. They came on board. They're willing to partner with us. We spoke to the Singaporean minister, who very quickly arranged with our IT team, gave his IT personnel, and we were able to get the source code. There's a team at the University of the South Pacific, the IT team, worked with the developers. We tweaked it to suit local conditions. And then, Mr. Speaker, sir, Fiji Care is actually funding the entire marketing of this app, because we need to get all Fijians to understand how important it is to get this app. So there'll be radio programs, there'll be radio advertisements, TV advertisements, billboard advertisements to get everybody to be on this app, which will prove to be beneficial not just for visitors coming to Fiji, but also for Fijians. And more importantly, it will help the Minister for Health, the team of the doctors, in particular Dr. James Fong, who does all the logistics side of this, to be able to do the tracing really quickly. And of course the RFMF and the police that are assisting will make their work a lot easier. It also will put us, and we will be able to market ourselves as a safe destination for those intended visitors to Fiji, and it will be very much part and parcel of the integral game plan going forward. Thank you, Mr. Speaker, sir.
I thank the Honourable Attorney General for reply to the question. Honourable members, that brings us to the end of question time, and I thank all honourable members for your contribution to today's sitting. Parliament is now adjourned until tomorrow morning at 9:30 a.m. We adjourn.